Hello and welcome. I'm Patricia Kaufman, the co-founder and communications director of the CLL Society, here to welcome you to today's Ed Forum entitled ASH 2020 Comes to You. Each and every year for the past 10 years, Dr. Brian Kaufman, joined in recent years by CLL Society's Medical Advisory Board, reads through hundreds of American Society of Hematology's annual meeting CLL-related abstracts to deliver to you the latest, the most credible CLL research data, meaning that data which is most likely to impact either your current or your future CLL treatment. And today we are joined by two remarkable CLL experts who are invited to present their research at ASH 2020, Dr. Anthony Mato and Dr. Bill Weirda. They are here to help us to better understand the research they are involved in and to answer your questions. At CLL Society, we know that it is critically important for all CLL patients and their caregivers to have access to this cutting-edge research from ASH and to have it explained to us in patient-friendly terms. At CLL Society, we believe that smart patients get smart care. We would like to thank AbbVie and Genentech for making this forum possible through their grant support. As you know, we have a very full agenda today with terrific speakers. At this time, I would like to introduce Dr. Brian Kaufman, Executive Vice President and Chief Medical Officer of CLL Society.
Thank you, Patty. It's my pleasure to introduce today's excellent speakers. We're going to start with Dr. Anthony Mato. He's the director of the CLL program at Memorial Sloan Kettering Cancer Center in New York City. And he's going to be exploring the excitement around a new drug, LOXO-305, that's still experimental. This is a next generation, highly selective, non-covalent binding BTK inhibitor. And if you don't know what that means, Dr. Mato will explain it to you. Then he's going to share some updates from the Inform CLL registry. This is real world data that validates the CLL Society's continued test before treat outreach and why that's so important. And he's also going to talk about a new promising one pill triple combination therapy targeting one of the great unmet needs in Richter's transformation. And he'll be discussing other things too as he goes along. We're really lucky to have in our next speaker, Dr. William Weirda. Dr. Weirda is the D.B. Lane Cancer Research Distinguished Professor and Clinical Medical Director in the Department of Leukemia and the Executive Medical Director at the University of Texas at MD Anderson in Houston, Texas. Dr. Weirda is one of the most well-known and well-regarded CLL experts in the world. And he will be exploring updates from the Transcend trial. This is the trial of a CAR T therapy, Lysocell, or JCAR017, and its use in combinations with ibrutinib. And he will also be presenting data from the MRD cohort, so the minimal residual disease cohort of the Captivate study, which looks at a combination that's of interest to a lot of patients of venetoclax and ibrutinib sequentially. I'm your third speaker, and I'm going to be presenting half a dozen or so papers that Dr. Mato and Weirda didn't have time to get through, or they weren't involved directly in the research, that I think will be of interest to everyone in terms of how CLL is monitored, how it's managed, some new drugs, and some new combinations. And I'm also going to talk about a very exciting treatment for Richter's transformation. After this, Linda Lanham will share how learning from the ASH annual meeting is of critical importance to the well-being of CLL patients, and she's going to do that from a caregiver's perspective. Linda is a very articulate and wise teacher, and it'll be very worthwhile to hear what she says. Lastly, Robin Brumble, a registered nurse and our new Director of Scientific Affairs at CLL Society, will share with you all the programs and services that CLL Society users uh, have have access to, and why we feel it's important that you know about all of these, including bringing you the latest research from ASH as we're doing now. Thank you for joining us. And now we turn to a great CLL teacher and clinician and researcher, Dr. Anthony Mato.